Hypothyroidism. Hypothyroidism, or underactive thyroid disease, is a condition that happens when your thyroid gland does not make or release enough hormone into your bloodstream. As a result, your metabolism slows down. This can cause unintentional weight gain and make you feel exhausted all the time. Although weight gain and fatigue aren't specific to hypothyroidism, a simple blood test can help your healthcare provider check for this condition. In general, hypothyroidism is very treatable. Most people can manage the condition with medication and regular follow-up visits with their endocrinologist. Left untreated over long periods of time, hypothyroidism can become life-threatening. If you develop new symptoms, it's important to get an evaluation. Types of hypothyroidism. There are 4 main types of hypothyroidism. 1. Primary hypothyroidism directly impacts your thyroid and causes it to make low levels of thyroid hormones. In turn, your pituitary gland makes more thyroid-stimulating hormone. Autoimmune conditions like Hashimoto's disease can cause it, or it can happen after thyroid gland surgery or radiation therapy. Primary hypothyroidism is the most common type. 2. Secondary hypothyroidism occurs when you have an underactive pituitary gland. This rare type of hypothyroidism prevents your pituitary gland from sending TSH to your thyroid gland. 3. Tertiary hypothyroidism happens when your hypothalamus doesn't make enough thyrotropin-releasing hormone. As a result, your pituitary gland can't make enough TSH. 4. Subclinical hypothyroidism, also known as mild thyroid failure, happens when you have slightly elevated TSH levels, but all other thyroid hormone levels are within a typical range. Subclinical hypothyroidism usually goes away on its own in about 3 months. How common is hypothyroidism? Hypothyroidism can affect anyone. It's most common among females over age 60, particularly after menopause. Symptoms of hypothyroidism. Hypothyroidism symptoms usually develop slowly over time. In some cases, it can take years. Some possible symptoms include 1. Brain fog. 2. Depression and anxiety. 3. Dry, coarse skin and hair. 4. Elevated blood cholesterol levels. 5. Fatigue. 6. Frequent or heavy menstrual periods. 7. Hoarseness. 8. Inability to tolerate cold. 9. Numbness or tingling in your hands. 10. Physical changes in your face, such as drooping eyelids, puffiness around your eyes. 11. Soreness or muscle weakness. 12. Unexplained weight gain. What causes hypothyroidism? 1. Hashimoto's disease is the most common cause of hypothyroidism. It's an autoimmune disease, so it happens when your immune system attacks your thyroid. 2. Certain medications, including lithium, thalidomide, and amiodarone. 3. Conditions present at birth, like being born with no thyroid gland or a thyroid gland that doesn't work properly. For iodine deficiency. 5. Pituitary gland disorders, including non-cancerous tumors. What are the risk factors for hypothyroidism? Anyone can get hypothyroidism, but you're more likely to develop the condition if you're female or have 1. Autoimmune disease. 2. Genetic predisposition. 3. History of thyroid surgery, including thyroid gland removal. 4. Pregnancy. 5. Previous history of head and neck radiation therapy. 6. Started or stopped certain medications. What are the complications of hypothyroidism? With treatment, hypothyroidism complications aren't very common. But left untreated, an underactive thyroid can lead to other health conditions like 1. Goiter. 2. Heart issues. 3. Infertility. For miscarriage or birth defects. 5. Peripheral neuropathy. 6. Myxedema coma. Diagnosis and tests. A provider will press gently around your thyroid during a physical examination to see if your gland feels swollen. I'll also ask about your symptoms and review your medical history in detail. Healthcare providers usually run thyroid tests to get an accurate hypothyroidism diagnosis. This is because an underactive thyroid can cause symptoms that mimic other unrelated health conditions. Thyroid blood tests measure the level of thyroid-stimulating hormone in your blood, as well as the levels for each thyroid hormone. You might also need imaging tests of your thyroid, which could include 1. Ultrasound, 2. CT scan, 3. Thyroid uptake scan. Management and treatment. The most common hypothyroidism treatment is hormone replacement therapy. Levothyroxine is a medication that replaces the hormones that your thyroid can't make naturally. Most people take it in the morning on an empty stomach. Taken daily, levothyroxine can even out your hormone levels and eliminate your symptoms. It'll take a bit of trial and error to find the right dosage. To do this, your provider will run routine thyroid blood tests until your TSH levels even out. You'll need to take hypothyroidism medication for the rest of your life. With careful management and regular follow-ups with your healthcare provider, you can lead a normal and healthy life. How soon after treatment will I feel better? Medications like levothyroxine start leveling out your hormones right away, but it usually takes a few weeks to notice an improvement in your symptoms. Remember, you'll probably need to take hypothyroidism medication for the rest of your life. If you stop taking it, your symptoms will likely return. Outlook, prognosis. Can hypothyroidism be cured? Currently, there's no cure for hypothyroidism, but you can successfully manage the condition with hormone replacement therapy. How long hypothyroidism lasts? Hypothyroidism is a lifelong condition. If you receive a diagnosis, you'll need to take medication every day to keep your thyroid hormone levels in check. Outlook for hypothyroidism. People with hypothyroidism have a great outlook if they receive treatment. Left untreated, an underactive thyroid can cause life-threatening complications like myxedema. Prevention. Can hypothyroidism be prevented? You can't prevent hypothyroidism. If you develop symptoms like the ones mentioned above, let your healthcare provider know right away. Early diagnosis and treatment are the best ways to reduce your risk of complications and live a healthy life. When should I see my healthcare provider? If you develop hypothyroidism symptoms like weight gain, dry skin, or fatigue, let your healthcare provider know. They may want to run tests to rule out other conditions. If you already take medication for hypothyroidism, let your provider know if your symptoms come back or persist. They may need to adjust your dosage. When should I go to the ER? You should head to your nearest emergency room if you develop the following symptoms. 1. Difficulty breathing. 2. Extreme lethargy. 3. Low body temperature. 4. Low blood pressure. 5. Slow heartbeat. These symptoms may indicate myxedema, a life-threatening condition. If you're experiencing these things, you need immediate treatment. By Joshi Joseph. Thank you.